everyone, welcome back to my channel, Happy Healthy Smiles. Thank you so much for joining me. My name is Farah. I'm a registered dental hygienist, and today we're talking about a really important subject, and that is how to prevent cavities. Actually, all these tips will also help kids learn how to prevent not just cavities, but gum disease. Since I've been practicing, I've noticed a lot of cavities and especially gum disease occurring. So all these tips that help to prevent cavities, same thing will apply to preventing gum disease. So before we get started, I'm just going to explain what a cavity is. Cavity usually occurs and needs three components. So number one is microorganisms or bacteria. Number two is carbohydrates, starches, sugars. And number three is it needs a susceptible tooth structure. So all those things, when you have them, and there's a lot of dental plaque, the dental plaque has a lot of acid, and that acid will demineralize or break down the tooth structure, and you'll have decay or a cavity. Now, here are some of the tips that are really important in preventing cavities and gum disease for kids. Number one, I know that kids are not brushing on a regular basis, at least 2 times, and they're definitely not flossing. So I know it's really basic, but really important is to have kids brush minimum twice a day, morning and evening. And evening brushing and flossing is actually critical because you're sleeping for a long time, for at least 10 hours, especially very young kids, and all that sugar, the plaque, and all that acid that builds up will stay on your teeth for a long time. So very important, start the kids flossing as early as age 2. Yes, age 2. At age 2, usually normally they have all their primary dentition, which is all their baby teeth have erupted. So usually kids have 20 baby teeth, and it's a good time to start flossing because a lot of the teeth are very close together or very tight, and even if they're spaced apart, really good idea to start flossing. Second thing you can do is use fluoride toothpaste if your child can spit out properly. Now, if your child is still young and is swallowing most of the toothpaste, please use a fluoride free toothpaste because you don't want a lot of fluoride being ingested. Instead, what you can just do is give them a lot of water with fluoride. And that brings me to water. Water is really good because it has fluoride, and all studies so far have shown, and there's been numerous studies done, that the fluoride water really helps reduce decay. Another thing you can do is help kids brush their teeth. The younger kids, like 2-3-year-olds, let them brush and then go in after and brush over, especially the back areas. And another thing I recommend is electric toothbrushes. New ones are great. There's a lot of choices. Oral-B, Sonicare makes really great toothbrushes. And maybe around age 6-7, a little bit older, I find 2-year-old or a 3-year-old might be a bit young for the electric toothbrush. It might be a bit too harsh for their gums. And another tip is don't share your food, drink, utensils with kids. Did you know that tooth decay is actually an infectious disease? An adult mouth contains about at least 300 different species of bacteria, and it has over 1 billion bacteria. So really important not to transfer your bacteria and avoid sharing food, drink, utensils with young kids. Another good tip is make sure the kids are going for a regular checkup and cleaning. The early on, the better, because we can see or assess what any issues are occurring before they become serious. We can catch cavities early on, and if there's a lot of plaque being built up, we'll go over best way to brush and remove. I always talk not just with the parent but the child too, and show which areas need improvement, and we discuss also healthy snacks and which toothbrushes are better. And another great tip is avoid constant snacking, especially snacking on sticky foods like gummy bears. So keep your snacking to a minimum, have really good meals, and try to snack on healthier foods. And like I said, avoid sticky foods and also avoid too many or limit cookies and chips, and also limit or avoid gummy bear vitamins. I find those vitamins are really problematic because anything that sticks and is sugary will stay for a long time on the teeth surface, and that means it'll promote more plaque and more chance of decay. And a study I was reading about gummy bear vitamins is the vitamins are not consistent in those little gummy bears, and they're not really good source of vitamins sometimes. So you might want to check that out. Talk to your family doctor. Another good tip is avoid sugary drinks. Juices are really on the rise as chocolate milk, pop. Try to reduce or limit them. Actually, I really recommend parents eliminate juices. Instead of juice, have the fruit. It has the fiber. It's good for chewing, especially like apples, and it helps promote growth in the jaw. So stay away from too many sugary drinks. Another really good tip is, I had mentioned before, eating really healthy snacks like fruit, vegetables like carrot sticks, celery sticks, water-rich, dense foods like watermelon. It helps keep the mouth moist. And healthy snacks like nut butters if there's no allergy issues. So I hope all these tips help. And just want to go back to the brushing. Really, really important. Concentrate on the gum line area with the kids, and especially on the inside, on the back molars. Those are really common. And there's really great flossers for kids. So this one comes in with a package of 3 or 4. So these are really good. Help the child learn and help them floss. So anytime the young child is flossing, please supervise them. I hope all these tips help, and if they did, please hit the like button and subscribe. Thanks so much, and I hope to see you soon. Bye.